Oncologists of Reddit. What's something that you never always do or eat because of what you know about cancer? Story 1. Tobacco anything. Never. Alcohol. Should really be never, but I consume it only lightly. Screenings. Never skipping one when it is recommended. All this to say, I still got breast cancer at the ripe age of 36, so sometimes you just can't do much about bad luck. Story 2. Oncology nurse here. I would never skip recommended cancer screenings, and I would never ignore weird, unexplained symptoms, sudden weight loss, blood coming out your butt, ongoing abdominal pain, excessive bleeding or bruising, odd skin lesions, swollen lymph nodes that aren't related to acute illness. It's heartbreaking when people ignore symptoms and don't get diagnosed until the cancer is too advanced for treatment to be helpful. Also, I'm a big fan of sunscreen. Surgeries to remove skin cancer can do some gnarly things to your face. Story 3. Former fellow of the National Cancer Institute. Here I hate to tell you this, but it's alcohol. It directly causes at least 7 kinds of cancer. 20 years from now, we will talk about alcohol the way we talk about cigarettes today. Story 4. Not an oncologist, but I'm a radiation therapist, so I treat cancer patients every day. Obviously, there are lifestyle habits you should avoid because they are linked to certain cancers or considered risk factors associated with certain cancers. That being said, one hard truth I've learned in my years of doing this job is cancer really doesn't discriminate. If it comes for you, it comes for you. I've treated 11-month-old babies with brain tumors, a woman who never smoked a cigarette or had a drink in her life and did not have the BRCA gene and got cancer in not one but both breasts, 11 years apart. Both primaries and not related to the other. Triathletes with leukemia, it's an evil and unfair disease. Now I'm in a specialized field where I only treat skin cancers with a superficial treatment machine, so I see less death and despair. My best piece of advice is wear sunscreen and get your moles and spots checked. Health insurance typically covers a yearly total skin check at a dermatologist. Story 5. Cancer biologist researcher of 20 years. Avoid all tobacco. Don't skip screenings. Limit alcohol. Try your best to control your weight. Use as little plastic as possible for food storage and drinkware glass is best. And never put plastic in the microwave. Story 6. Oncologist here. Don't smoke. Maintain a healthy weight. Eat and drink what you want within this framework. Alcohol in moderation is fine. Cancer is partly genetics, partly exposure, and mostly just age and bad luck. Story 7. My best friend's mom is a breast cancer specialist who previously worked in the ER. And this is real, she says the #1 behavior she rails against is riding motorcycles. So many gruesome deaths. You can fight cancer, but you can't scrape that body back off the ground or reattach heads. Also, smoking is bad. Story 8. Vaping. Exactly because we don't know if it causes cancer. When I gave up smoking, everyone pushed me to switch to vaping, and I was like, no thanks, bro. I have no interest in being a guinea pig for this technology, which will inevitably be found to cause 28 different cancers and will probably steal your girlfriend too. Story 9. Cancer researcher here. You can do everything right and still get cancer. You can do everything wrong, smoke, drink, be fat, etc., and not get cancer. It's bad luck and genetics. Story 10. Not an oncologist, but my late father was. Don't smoke, don't drink alcohol, don't be overweight, wear sunscreen, minimize eating. Eat fibrous vegetables, foods containing turmeric. Don't hesitate to advocate for yourself when using health professionals. And if they're tossing up whether to go gently or radically, always opt for radically because one day you'll need the radical surgery anyway, and by then you'll be less likely to fully recover. One other thing he swore by was having a social life because happy and supported patients last longer, even when terminal. My old man died aged 80 of, the irony, a rare cancer with a genetic link. So my own advice is always to keep your MOT screening appointments with the GP. Story 11. Not an oncologist, but I had an air pollution lecturer once state that he does not eat barbecued food because of the charring and smoke residue carcinogen levels. Story 12. Bone marrow transplant hematology oncologist here. Do not smoke. It doesn't matter what it is, no smoking. Also increase your fiber and avoid areca and betel nuts, and get the HPV vaccine 9-valent now available up to age 45. Story 13. All you MFS in here, trying to extend your life. Have you not had a good gander of how the world is now? Eat the cake, drink the wine, enjoy that bacon. We're all gonna die anyway. Why not enjoy the few things available to us? In addition, my mom never smoked or drank and ate healthier and exercised more than any one old person I knew. Yet she died of a nasty throat-mouth head cancer that did her in a couple of years ago at the age of 76. My dad drinks like a fish and smoked for 25 years, and at 78 he's still kicking with minor health issues. It's the luck of the draw in my opinion. Story 14. I'm an oncology nurse, and I go out of my way to never heat anything up in plastic. I go out of my way to not buy any drinks that are in plastic. I also pretty much drink alcohol maybe once or twice a year. Sunscreen, no matter what daily physical activity, no matter what. Story 15. I stopped eating cold cuts due to nitrosamines and also stopped eating burned charred food. I even do not eat toasted bread that's more than light brown shade. I used to drink very hot coffee, but I drink it warm now since very hot drinks damage esophagus can cause esophageal cancer. Story 16. This is a hilarious question. My oncologist laughs at me when I bring up how I eat for my health. Well, not laughs, but to him, there is no connection. Story 17. I'm not a doctor. But I've got to say, I've met people who never touched a drop of alcohol, never went anywhere near tobacco or coffee, and they still died young of cancer. Point being, you can do everything right and still die. I'm not saying you should smoke and drink your face off, but just have some perspective. Story 18. I will always make sure my nieces and nephews are well protected in the sun. Sunburn, especially in childhood, is what significantly increases the risk for melanoma. I also nag at my other family members about good sun protection, as it is prolonged sun exposure that increases the risk of non-melanoma skin cancers. Wear your sun cream, people, and do not use sunbeds. Story 19. As someone who grew up with an oncologist in the family, though they are now retired, I can share they don't eat red meat. They eat a balanced diet of fish, poultry, lots of fruits, vegetables, and one sweet a day. They take daily vitamin supplements. They drink alcohol very rarely, special occasions, holidays, etc. Keep it to 1 to 2 beers. No tobacco, drugs. Walk daily, lift weights twice a week at 80 years old. No pesticides on the lawn, as if it kills one type of vegetation, it will kill all of the innocent critters, eventually us. And wears sunscreen daily, SPF 30. Story 20. I work in path, meaning I'm a doc who uses a microscope to see the up cells taken out of the PT and order whatever molecular-based, immunology-based workup for the actual docs. It's immunohistochemistry for identification and prognostication. On one point, I've seen cancers linked to years of smoking and alcohol use. I've seen cases of colon and cervical cancers in people who've neglected their screenings. I've seen peds with more risk factors than a rap sheet have a mildly dysplastic growth on their insert anatomical part here and live perfectly normally afterwards, on the other hand. Just like many of the people who've commented here, there's been a rise in number of PTs with late-stage stage 2, 3, or 4 breast, cervical, ovarian, lung, stomach, kidney, etc. cancers in PTs with few, if any, risk factors, the cause of which is still unknown as to what's driving this increase. Whoever finds out why more Gen Xers and millennials are getting cancer at such higher incidence rates than BBs will win a Nobel. In essence, eliminate whatever bad habits you can, such as smoking and drinking. Get exercise, eat fiber, but don't see it as a guarantee against cancer. No one is too young to get it. Youngest colorectal case I saw was in their early 20s, but raising up symptoms with a doc who actually cares is important. Too many of the old-school BB docs blowing off symptoms when there's been a massive rise in LAMNs, aggressive ovarian cancers, and diffuse gastric adenocarcinoma in this country. In addition, targeted therapy and immunotherapy, plus targeted radiation and/or new chemo protocols for leukemias and solid tumors has grown exponentially, mainly due to advances in molecular characterization. Just recently, as of 2 months ago, we are testing for a certain molecule common in GI cancers that, if present in someone's tumor, renders them eligible for a newly developed targeted therapy option. Story 21. Cancer nurse here. If you get any unusual symptoms such as lethargy, swollen glands, pain, weight loss, night sweats, a cough that won't go away, etc., go get a simple blood test. If you're bloated, have abdomen or back pain, changes in urine color, Headaches that persists. Breathing changes, get an X-ray CT ultrasound. If your GP dismisses you and doesn't investigate at all, go get a better GP. The amount of patients that have been diagnosed late have usually been to their GP a few times and not had any tests performed. You can't always prevent cancer, but you can certainly catch it early and give yourself a better chance of beating it. Story 22. Not oncologist, but hospice nurse. End-stage alcoholic liver disease is the most horrifying way to go, and doing what I do has completely changed my relationship with alcohol. Story 23. Hematopathologist here. I never use herbicide weed treatments on my lawn. I've seen too many childhood leukemious lymphomas, especially in children of parents who work in lawn care. I also don't smoke or drink alcohol. Story 24. Red meat. And N-glycolylneuramic acid. NU5GC, a sugar molecule found in red meat, including nanase, has been linked to increased cancer risk in humans. Here's how it relates to cancer. Risk NU5GC is a non-human sugar. Humans cannot synthesize NU5GC due to a genetic mutation, dietary absorption. When humans consume red meat, such as jania, containing NU5GC, this sugar molecule can be incorporated into human tissues. Immune response and inflammation. The human immune system recognizes NU5GC as a foreign substance and generates antibodies against it. Repeated consumption and subsequent antibody response can lead to chronic inflammation. Increased tumor formation. Chronic inflammation is known to increase the risk of tumor formation. Evidence from studies. Studies in mice lacking the ability to synthesize NU5GC, mimicking the human situation, showed that feeding them NU5GC increased spontaneous tumor formation and inflammation. Studies have also shown that human cancer cells can incorporate NU5GC, which can then activate pathways that promote cancer cell growth. Research suggests that NU5GC may affect the gut microbiome, potentially promoting inflammation and cancer risk. And NU5GC is specifically mentioned as being rich in NU5GC. Cooked organ meats. Studies indicate that NU5GC is particularly prevalent in pig organs and that its concentration can increase when cooked. In summary, the presence of NU5GC in EI, when consumed by humans, can lead to chronic inflammation and increased cancer risk through its interaction with the immune system and its potential to promote tumor growth. Not an E in key, however, as a doctor I have to say, limit your alcohol consumption and get daily exercise. There is no way of cancer-proofing. You can take steps, however, it's also largely genetic, non-avoidable exposures. One thing I'll add, the better shape you are when you do get sick, the better you'll handle the treatment. Story 25. Something that always surprised my breast cancer patients is when I tell them to avoid vitamins, especially antioxidants, as they could be associated with more risk of recurrence and DIYing from cancer if you take them while on cancer treatment, or even before treatment. There is a lot of information regarding this issue with contradictory results, but until we get better information, it is logical to be cautious about vitamins. Here is one of the articles I base my recommendation. Story 26. Not an oncologist, but I am anesthesia and do many an anesthetic for these. Unexplained weight loss is always bad thyroid issue or cancer. Blood and stool sputum, daily headaches worse in the AM, night sweats, lymphadenopathy, lumps and bumps, moles that look odd. Get skin cancer checks, screenings. Don't smoke. Limit alcohol. Try to be healthy weight, but alas, much is genetic. Story 27. It's already been said a bunch, but hard agree, so I'll repeat it again. Do not smoke tobacco. Do not drink alcohol. Always get your screening anything, but I feel extra strong about colonoscopies. Never ignore stools. Story 28. Unfortunately, medical school does not cover nutrition the way it should. My toddler just went through a year of cancer treatments, and her oncologist and the nutritionist really only cared about her calorie intake, not what the calories were. It's very disheartening and makes you realize why the number of people with cancer keep rising significantly. Even the doctors treating the cancer don't really care about the foods that are causing it. Her father and I cringe when she goes for follow-up scans because the wing was donated by a major processed meat company, knowing processed meat is a Class 1 carcinogen. But welcome to America, where a patient healed is $1 lost. Story 29. Oncology genetic counselor here. It's literally my job to figure out if someone's cancer is due to inherited risk and assess lifestyle risk factors that contribute to diagnoses. Things I would never do. Smoke increases risk for lung, breast, pancreatic, colon cancers, and more. Alcohol. There is no safe amount. Increases risk for colon, pancreatic, breast cancers, and more. I tell my patients to limit it to weddings and funerals if they can. Aspartame in many diet sodas may increase risk for colon cancers. Eat too much red meat no more than 2 servings weekly on average. Increases risk for colon cancer. Controversial, join the armed services in the U.S. The number of people who developed cancer because of something they were exposed to while serving is just mind-blowing. Camp Lejeune, asbestos in the Navy, the tar pits, Agent Orange, etc., etc., etc. Always recommended. Keep your primary care informed about your family history of cancer and other conditions. But that's not our focus here because it may give you access to earlier or enhanced screening. Screenings: mammogram, colonoscopies, prostate, skin, exercise. 30 minutes of cardiovascular exercise 3 times a week is correlated with a lower breast cancer risk. Keep a healthy body weight too much, and the risk for uterine, colon, breast cancer, and more increases. Fiber reduces risk of colon cancer. Sunscreen: basal cell carcinoma is the most common cancer in the world. Talk to your doctor if you're experiencing any ongoing unexplained symptoms, especially weight loss, fatigue, blood rectally, or unexpected vaginally, pain, new lumps, bumps, skin lesions, new changing moles, ongoing diarrhea, constipation. 2-week rule can help distinguish a random symptom from something that's more concerning. I like to tell patients it's probably not cancer, but with your family history, talk to your doctor and make sure. My biggest advice: do what you can to improve your lifestyle and do the screenings to hopefully catch diagnoses that are out of our control. Story 30. My Sil has always been insanely healthy. Her degree is in nutrition. She is very active, never smoked, rarely drank. She is 58 and has terminal breast cancer. Story 31. This is less for what one can do for oneself and more to keep an eye out for. Along with chance, genetics, smoking, and alcohol, a difficult childhood with adverse experiences can also significantly increase chances of cancer. A kid can have been in a bad home and do everything right and get hit with cancer because their caretakers didn't do right. Published CDC review. Story 32. With that, how do you oncologists feel about intermittent fasting? My understanding is that it destroys abnormal cells as your body is detaching for nutrition before switching into ketosis. Story 33. Koipla. Story 34. RN breast cancer survivor. Avoid cigarettes. Alcohol: there is no safe amount for cancer. Obesity increases risk of cancer and heart disease. It's especially bad for breast cancer. Sedentary lifestyle increases risk. Avoid sugar, nitrates in lunch meats, and grilled meat. Processed foods. Plastics, especially water bottles. Do eat fresh fruits and veggies. Move your body. Add whole grains and fiber to avoid colon cancer specifically. Add fermented foods for gut health: yogurt, kefir, sauerkraut, etc. Drink coffee up to 3 cups daily. Decreases death from all causes. Cancer-included mind-body wellness, such as yoga and meditation, are also helpful. I was shocked to learn that 150 minutes of exercise weekly reduces my breast cancer recurrence risk by 40. The shitty therapies I'm on only reduce it by 50 and cause tons of side effects. I knew exercise was good for you, and I've always been active, but I really stepped up my game and walk 3 to 5 miles 5 days a week now. Story 35. Cancer scientist and epidemiologist PhD. Echoing what many have said. Tobacco: never, sunscreen, always. Alcohol: moderation, less is better. A huge fan of the HPV vaccination for both males and females. So many preventable cervical and head neck cancers. Get recommended screenings, and if you have an inherited predisposition, talk to your physician about an alternative screening schedule. Try to move your body and eat nourishing foods. Everything else is pretty debatable. Live your life, and if something feels or looks weird, get it checked out. Story 36. I'm not a doctor, but I got a rare, deadly cancer at 33 with no risk factors. Mine is most common in men over 65 who have poor lifestyles, heavy drinking, etc., but I am a young woman. You can do everything right and still get cancer, but of course it's still best to live a health lifestyle and avoid known carcinogens. Story 37. I am not a doctor. However, I want to mention being overweight is an issue with estrogen breast cancer. Fat attracts estrogen. Estrogen impacts the breast cancer. Story 38. Why do doctors keep recommending mammograms for women with dense breast tissue? Mammograms can't detect it in dense tissue until it's too late. Why aren't they doing MRIs and ultrasounds instead, which can detect it earlier in dense tissue? My wife just found this out the hard way, and she was shocked that she was getting the wrong kind of scan every year. Now it's probably too late for her. Story 39. A friend of mine's mom had cancer, and she actually educated herself on stuff that causes cancer and found that the amount of MSG a person would need to consume to get cancer would need to be bucket loads of straight MSG. So now I enjoy eating delicious food. Also, Splenda is fine. I Splenda TF out of my tea, lemonade, pancake mix, etc. And I enjoy diet soda. Knowledge is power. Story 40. Why do I feel like getting cancer has way more to do with having spent large amounts of time around unknown, at the time environmental factors than things ingested by way of living? About 810 people close to me that got cancer was either from working around toxic substances for years back in the day, living in a house for years with radon or uncovered fiberglass, working as security for years guarding closed-down power plants, or having a job with some type of ink that used to be cancerous. Come to think of it, these were all men in my family who passed and never got diagnosed until they were terminal. A couple even went to the doctor constantly complaining of gastric issues or hacking up from their lungs and were either passively ignored or it just went undetected in their screenings. All the women in my family who got it passed of cancer were told it was due to genetic components. However, my aunt did feel that her ovarian was due to using her grandmother's baby powder growing up. So it was even older than the type that was around in her youth in the 50s. Story 41. Yeah, it's a crapshoot. 20 YR smoker, heavy and light drinking. 45 year wars, various drugs. Physical recklessness. 10 YRs, very bad diet. 30 YRs. 60. Cancer, free sister, has never smoked. Done drugs? Light drinker, decent diet exercise. Cancer at 55. I will say that while being currently cancer-free is great, there are plenty of reasons to take better care of yourself than I have. Being cancer-free at 60 is great, but not so great when you feel closer to 80 half the time. Story 42. Only drink water. Never anything else. No juices of any kind. Milk from almonds only. Only eat leafy greens and use beans as protein. No alcohol, ever. This includes cooking wine. Any dishes with alcohol being used as prep is linked to cancer. Limit of 30 minutes of direct sunlight per day with SPF 100. Limit of 30 minutes of moonlight per night with SPF 50. No hot showers, ever. Sitting is forbidden too as it's linked to cardiovascular disease. Sleep standing up. Be happy regardless of major traumatic events or life stresses, as this is directly linked to cancer. Don't worry about the cancer either. Otherwise, cancer or more cancer. No smoking, obviously, but this includes never having campfires because those cause cancer too. Story 43. Not necessarily an oncologist, but a biologist that has done cancer research at various points in my career. I try to only pay attention to the risks and things I am doing repeatedly for years. Things like one time, asbestos exposure and huffing some fumes every once in a while don't worry me. But the things that are part of my daily routine, I'm more careful about. Story 44. Fiber antioxidants in the diet. I do a shot of high polyphenol olive oil each day. Sunscreen, plenty of exercise. I cut out alcohol except special events. Protect your gut microbiome from unnecessary antibiotics. Our healthy bacteria keeps our immune system in balance and is linked to better cancer surveillance. That's what I preach in my neuro-oncology clinic anyway. Story 45. My close friend's mom was put on mood stabilizers and given psych appointments after she experienced falls, panic attacks, and fainting. When she lost vision in one eye, they actually did some scans and determined that she didn't have anxiety. She was dying of eye cancer that had spread to her brain. Story 46. Hemonx NP here. Smoking is a big one. I don't smoke and avoid secondhand smoke. I avoid plastic and silicone utensils being used with hot foods. Alcohol ideally should be avoided, but I consume in moderation. I'm significantly more cautious about alcohol intake since getting into this specialty. Red meats are a sometimes treat. I also do my best to avoid overly processed foods now as well. Story 47. I had 3 students die too young. One got cancer, one had friends who played with guns, and one rode a motorcycle. Nothing the first one could have done about it. Story 48. I'd say 80 of the non-breast cancers I see are heavily contributed by smoking, heavy drinking, and excessive sun exposure. The remaining 20 are bad luck without any obvious cause. Get your proper screenings. Colonoscopy and mammogram guidelines have changed to push them earlier for the average risk person. Colonoscopies at 45, mammograms at 40. I have to tell my friends about this. For some reason, their PCPs don't seem to keep up with the guidelines. Story 49. Not an oncologist but am a PhD scientist in drug development biotech. I avoid meat and eat a mainly plant-based diet. And that avoids most of the food-associated carcinogens: cured meat, BBQ meat, meat cooked at high temperatures, processed meat. I also avoid French fries. It has the same problem of being cooked at a high temperature, and in this case the formation of acrylamide, which we used to use in the lab. It's a strong cross-linking agent and must be handled in the hood. I'm also very cautious about cheap spices and tofu. They can be contaminated with heavy metals, spices, and paraformaldehyde. Tofu, both of which should not be consumed in any quantity. Story 50. Tobacco of any kind. Oropharyngeal cancer, lung cancer, pancreatic cancer, breast cancer, colon cancer. It goes on. It's literally one of, if not the most modifiable risk factor. Smokers are some of the sickest and highest risk patients in medicine. Story 51. Never skip your colonoscopy. I'm under the age limit for regular screening colonoscopies, but would get one in a heartbeat if I could get my insurance to approve it. Story 52. Everyone's saying tobacco and alcohol, and here I am, as a 36-year-old dude that has never smoked and never drinks. Boomball cancer at 34. Caught it early though, so I think the most important advice is listen to the things your body is telling you and don't be afraid to ask your doctor about it. Story 53. Never eat red meat, no tobacco, and only occasionally a drink. I stay away from anything that is a known carcinogen and wear sunscreen. I've had 6 cancer diagnoses and always get my screenings. Story 54. I see so many patients who don't drink or smoke and don't have any risk factors, including genetic risk factors, end up with cancer. I think in time we will have more evidence that it is caused by something sort of environmental exposure we humans have caused. I also think regulation plays a role in preventing these from happening. I've practiced all around this country and am convinced that cancer is worse in red states and that it can only partially be explained by poverty and lack of access to healthcare. Story 55. I'm not an oncologist, but my mom worked as an oncology nurse. The amount of people who receive news that they have cancer and think about it for a year or two is mind-blowing. They need to accept news before starting treatment. When it's far too late. Sometimes they come in ambulance actively dying and tell you, "Our doctors, cure me." Why do you do nothing? They don't want to go home or in hospice, they want to stay in the hospital care. The people who are healthy after starting a treatment on the stage. I is 90. For some cancers, it is close to 100. Story 56. Definitely echoing the above sentiments. Avoidance of tobacco is an absolute must. Alcohol should ideally be a hard pass, but if not, limit it drastically. Regular screenings are a non-negotiable. Also, don't ignore any unusual symptoms, like unaccounted weight loss, stools, persistent abdominal pain, abnormal bruises or bleeding, weird-looking skin lesions, or unexplained swollen lymph nodes. It's really tough seeing people not take these signs seriously and then face a late-stage diagnosis when treatment options are much more limited. Oh, and slather on that sunscreen like there's no tomorrow. You'd be surprised at the serious damage skin cancer can do. Despite following all these preventative measures, sometimes it's just down to sheer unfortunate luck. Got diagnosed with breast cancer at 36 myself. But remember, alcohol has been directly linked to no less than 7 types of cancer. Pretty sure in a couple of decades we'll be viewing alcohol in the same adverse light we view cigarettes today. Story 57. According to a buddy of mine who works as an oncologist, I will never smoke, always wear sunscreen, and never microwave anything in plastic. That stayed with me. Story 58. A doc, but not once. There was a study several years ago about what doctors do and don't do as far as recommendations. Only thing that was consistent is docs avoided tobacco. Having said that, my grandparents smoked like stacks. Pneumonia is what killed them. Story 59. Moderation is more important than magical ideas about certain foods. Rather than thinking that some food or even some additive causes cancer or, alternatively, some berry or supplements prevent it, think about balance. Red meat isn't poison, but 15 servings a week isn't wise. If a person avoids tobacco, limits alcohol, keeps weight reasonably under control, shows a little attention to sun protection, and exhibits safety or restraint or both in adventures, they'll reduce their lifetime risk of dying from cancer by almost half. These so far outweigh any other factors that choices of what to eat become incredibly unimportant. And, if you follow current ideas about fundamental screening, you'll move the needle even further away from cancer death. Story 60. I was diagnosed with stage 2 breast cancer at 31 years old. Then I had it again at 50. I avoid nothing except tobacco and alcohol. Life is short, and I will eat, drink, and be merry. Not for everyone, but I want to be happy with the time I have left. Story 61. My dad's oncologist told me that smoked meats are carcinogenic, and my dad had bacon every day for his whole life. He also ate kielbasa and cold cuts, all preserved with nitrites. He said because my dad died of stomach cancer, I should never eat bacon or any other preserved meat. Story 62. So from what I've seen, the consensus seems to be don't go in the sun, don't eat meat, don't smoke, don't eat smoked foods, no hot foods, don't eat cold cuts, don't drink alcohol or coffee or caffeine, don't eat sugar, don't wear bras, don't wear tight underwear, and don't have cancer in your family history. Has anyone said water yet? Story 63. My mom is an oncologist, and frankly, she carries on with everything except avoiding sunscreen. Her idea is that everything causes cancer, but really, it comes down to genes. Obviously try to avoid drinking and smoking, but she even socially smokes cigarettes, haha. Story 64. Not an oncologist, but worked in cancer epidemiology for more than a decade. Besides some of the more known things like smoking and certain environmental exposures, e.g. asbestos, physical activity has a strong negative relationship with many cancers. As to dietary habits, it is a challenging field to study filled with lots of poor quality studies. Some relationships are well established, like alcohol consumption, and some, but not all cancers. I haven't kept up with it, but years ago, red meat was also associated with increased cancer risk, while certain vegetables were protective. Story 65. How do the oncology community feel about or have a solution for wastewater treatment? My father is currently undergoing chemotherapy, and we were told that any family member who has to clean up biohazard should wear gloves as his waste may contain chemo drugs. It goes all into wastewater, and I have not heard of any wastewater treatment that neutralizes the chemo drugs. As more people get cancer and get put on different therapy, including radiation and chemo, and the wastewater gets recycled, will healthy people eventually get cancer due to the lack of wastewater treatment? Story 66. Never smoked a day in my life. Barely ever drank. 10-mile-a-day runner. Went to my PCP cuz I had the worst back pain. It was hurting so bad, but then one day I couldn't even get up. I have 2 kids, so had to get my dad over to watch my kids and my mom to try to help me get a doctor. They gave me muscle relaxers. And I said I'd really like an MRI, something doesn't feel right. Got an MRI for a week later. Got told I had bone cancer that metastasized, and the primary source is from my lung. I now have stage 4 cancers. So just live your life, man, LOL. Story 67. I remember a quote from my pathology book. Robbins. Pathology, Neoplasia, Chapter. It begins to appear that almost everything one does to gain a livelihood or for pleasure is fattening, immoral, illegal, or even worse, oncogenic. Bottom line, carcinogens will always be around us. It's our job to lessen our exposure to it. Cancer is a demon I do not wish on anyone. For men, get prostate exams and colonoscopies. For women, get regular pap smears, colonoscopies, and breast exams. Wear sunscreen, drink moderately, and don't smoke. Story 68. Not an oncologist, but I work with them and cancer patients regularly. No tobacco, drink in moderation, exercise regularly, and vigorously sunscreen. And just as important, know your family history and consider genetic testing if you have lots of cancer in your family after visiting a specialized genetic counselor. Story 69. I haven't been to a doctor in 15 years. Doctors in the family. A career that's generally kicked me in the face. When it comes to recommended screenings and stuff, I don't even know how to find a doctor on my insurance. Much less what I need to have done when I both have no record and no clue. Genuinely, I feel like it's as easy to roll over and die from surprise cancer as it is to pay for some kind of treatment. I get that medicine has gone a long way, but it feels so very inaccessible as someone who almost qualifies as worthwhile in the US. I'm a freelance artist. Not trying to be dramatic, but yeah, I travel 30 weeks a year. I don't have a GP. I've been dropped from insurance in the past because my online statements have been mailed to me and unpaid because I'm on the road. Not sure why I'm posting other than a sense of hopelessness. If I get sick, you can have my stuff, I guess. If you grab my house keys from my pocket when I'm dead. Story 70. I'm not an oncologist, just a breast cancer survivor. My oncologist told me not to eat commercially raised beef. Beef in America has a lot of growth hormones, and 30 years ago, they thought it might contribute to breast cancer. 30 years later, I still don't eat beef, but that just because after not eating for so many years, it would definitely make me sick. Story 71. Eat well, so tea, drink, or smoke, get hit by a train. Yes, you should take care of yourself, but a lot of life is a crapshoot. Enjoy your life. It's fleeting under any circumstances. Story 72. What is the #1 cancer-causing food? Processed meats, which often includes hot dogs, deli food, and sausage, is categorized as a Group 1 carcinogen by the World Health Organization. Story 73. Had reoccurring pain in my lower left abdomen and what was thought to be reoccurring UTIs. Long story short, my GP started looking at past MRIs done for back surgery, 12 years earlier. Lo and behold, there was a large mass in my left kidney that was noted by the radiologist. Did my back doctor bother to tell me that? Nope. Probably could have saved my kidney, but when it was discovered, it was far too advanced. Now I'm having to deal with the possibility it has metastasized to my pancreas. Lesson here, folks, is to always read the medical test results. Advocate for yourself because no one else will. Story 74. I play an oncologist on TV. Avoid human. That will absolutely give you a leg up on avoiding cancers, ulcers, crash outs, and the like. Trust me. I'm an expert of sorts. Story 75. No tobacco. Don't smoke other stuff either. Limit alcohol. Wear sunscreen and cover your skin. I use a wide brim hat and long sleeves in the pool. No tan is worth developing a personal relationship with a dermatologist's instruments. Eat your veggies and avoid too much of the factory-farmed and industrial food. Get screened. Most of all, enjoy life because we still don't know whether you'll get cancer even with all the precautions. They just limit risk. Story 76. I'm not an oncologist, but if I were, I'd never microwave plastic, drink Diet Coke in a church, or trust a wellness influencer with a crystal in their bra. I'd also probably side-eye hot dogs like they owe me money. Real talk, if oncologists tell you they still smoke or eat burnt steak every weekend, run. Or tip them. They clearly know something the rest of us don't. Story 77. Current leukemia, patient and former cancer biologist. I switched to a different field of biology many years ago. I like to joke that microwaving the cups of noodles is what gave it to me. Partly because I did microwave the out of those things for years, and the type of cancer I got is related to the type of cancer you can potentially get from that. Styrene, which might contribute to causing a different version of leukemia than what I have been in remission for almost 2 years now. Haven't microwaved one of those yet. Have used the electric kettle I bought. Story 78. Just a random person here, but one thing I know, Grandpa from one side smoked all his life, like chain smoking every however minutes, 96, still kicking. Grandma from the other side, other parent, bought all the expensive stuff, all the health and bio stuff, exercise. No alcohol, no smoking. Avoided plastics, and dyes in foods, no fast food. You get the idea, very, very strict on it. I remember her making me and my siblings eat that stuff, no sugar, no this and that anyways. Stomach cancer, she passed. So cancer doesn't give a FK. Life ain't fair, live that. And get checked here and there. But I have heard from a friend who works in cancer stuff, apparently people who have their microwave up head height had more brain cancer, and people who have it down low in the kitchen showed to have more testicular, etc.